the priorities are misplaced. We do things, we say we want the big four agenda. We say we want UHC, but we don't put money into that. We put money into other things that are not in line with government priorities. Now, if coming back to UHC, we not only need to achieve accessible healthcare and affordable healthcare. That is very important. But quality care, as it has been said before, it is not nurses or one nurse. And most of the times, Mr. Wachira, you say that 2 nurses cannot take care of in a ward. It is very rare to find 2 nurses in a ward in Kenya. Very rare. You only find 1 nurse in any shift. There's nowhere you are going to find 2 nurses in Kenya in any shift. And you find 2, then maybe one is a manager and or one was off duty and he has come back, or one was leave and he has come back. So you find that a nurse are taking care of 30 patients in a ward or 50 patients. Then sometimes we do say, sometimes we don't practice nursing. It's like witchcraft we are practicing in the wards. Because how do you expect one nurse to take care of 30 patients? And yet you are looking for quality services. And as Wachira has correctly said, some patients die, not because their conditions made them die. They died because of poor services. And we are giving poor services. Why? Because you are constrained of resources, human resource. The other thing that leads to poor services is low levels of specialization. You know, a specialized officer would give specialized services. In nursing, we are very low on specialization. One of the reasons why we are having low specialization levels is because the government does not offer scholarships to nurses. And when it does, the scholarships at the ministry are skewed towards one cadre. You go to Afya House and you look at the list of scholarship, you'll just find one cadre dominating the scholarships. And yet money is, when you go and ask, you are told there's money for scholarship. But when you go as a nurse to look for scholarship, or even as a clinical officer, I'm sure Mr. Wachira can support me on that. There is only one cadre that is supported for scholarships. We need scholarship for nurses, we need scholarship for all healthcare workers without discriminating anyone, so that we can have high levels of specialization and we can have people working at their specialties. Some of these things that we are complaining about are not financial. For example, redesignation. When you go back to school, for example, you want to move from diploma to degree. Then you come back. You are supposed to be redesignated, so that the government now recognizes you have an undergraduate degree. This is not done at the county level. You find that a person who was at diploma level has gone for undergraduate studies. They are not designated. They have used their own money to go for masters, and they are still being recognized as a diploma, and they have master's degree. And this is very prevalent in my county, Kiambu County. I have a nurse who is doing her PhD now, but she's still being recognized as a diploma. And she's in PhD because resignation is not being done. And that does not require money. They just need to change your title from a registered nurse to a nursing officer. Simple as that. No money involved, but they don't want to do that. When you come to promotion, that's another issue. You find we have stagnated in one job group for more than 10 years. Or even, maybe in Kiambu we could be lucky. Since devolution, we've had, I think, 2 or 3 promotions. I think we could be the and maybe Makueni where Daktari was. But in most counties, and especially Nairobi, there are no promotions completely. And then you find a person in the same job group. So we have a demotivated workforce, a completely demotivated workforce that when you feel you are waking up to go to work, you don't feel like waking up. You feel like continuing to sleep because you wonder where you are going. Statutory deductions, as Daktari has said, you have already been deducted money for your insurance. You have already been deducted money for your NHIF and loans and bank loans. Yet, the government is not remitting the same to the bank. Isn't that a theft? Is it not illegal? Why is action not being taken to these people who are getting money from us and not taking to the bank? Then you get a call from the bank. Bernard, you have not paid your loan for this month. And if you have something in your account, which is rare, they take that. If you have any savings, which is very rare, they take that. Now you are left without nothing. But the county government has deducted money for that, and they are not paying.